right, now there may be a few of you who might recognize this next person. At least, you probably at least recognize his voice, right? Jon Caldera is the president of the Independence Institute. Jon is president of the Independence Institute, Colorado's free market think tank in Golden. Caldera also hosts a 3-hour-a-day radio talk show on the 50,000-watt blowtorch News Radio 850 KOA. His current affairs television program, Independent Thinking, on Denver's KBDI Channel 12, airs on Thursdays at 7:30 p.m., repeated the following Tuesday at 5 p.m. Ladies and gentlemen, Jon Caldera.
Can I just lift us out of here and take a 30,000-foot view for just a second? Forget healthcare for a moment. You people are heroes. I don't know if you understand what the hell is going on right now, but things are changing and you people are leading it, not these people. What's amazing here is that we've come to a harsh and terrible realization. These issues that affect our lives, they're not our issues, they're not D issues, they're not left, they're not right. It's them and us. And now we have finally learned we have to take charge because we can't leave it to them any longer. Now, I've got to ask a simple question when it comes to healthcare, which is, what's the rush? What is this? Now, the TARP bill came along, $700 billion of our children's future came along, and we had to rush, or else these corporations would fall and crumble, so we passed it without reading the bill. Then the stimulus came along, and we had to rush because our economy was in trouble. We need to stimulate it, and without reading it, we had to pass it. Remember how we felt. It's how some people on other sides felt when they had to rush to pass things like a Patriot bill without reading, and then afterwards they said, I didn't know that was in there. We have one goal here today. We have 7 congressmen, we have 2 senators. Let me hear it today. Gentlemen, ladies, before you vote, we demand you read the bill. Before you change the way our loved ones are covered with health care, before you change one of the most important fiscal and social issues of our lives for generations to come, we demand you read this bill. This is 1,200 pages. If you can't read Moby Dick, if you can't read Atlas Shrugged, then don't vote on this bill. If you took these pages together and laid them out, page after page, it would be over 3.5 football fields worth of paper. Read that first. It's a simple request. We asked our governor, we got no answer. Will he ask our federal delegation to read the bill? He wouldn't say so. I wonder if this man has read every bill before he signed it. I hope so. Before we embrace government-run health care, we need to ask a simple question. How's the health care that government already runs? Ask those people on Medicare. Ask those people on Medicaid. How is government-run health care working for you? If that system works well, then let's bring it on. If not, let's slow this up and have a real conversation. A quick personal story. Now, this is nothing to complain about, but I've got a terrible back. It's been bothering me for 2 years. I've done all the things my doctor wanted me to do, the chiropractic, the physical therapy. Finally, he said, you got to get an MRI. And I said, all right, where do I go? And he said, well, there's 2 or 3 places here. This is the one that we like. I called him. I had an MRI on my back the very next day. A colleague of mine who runs a think tank up in Calgary has back problems as well. Went through the whole rigmarole. His doctor said, you need an MRI. And he said, well, how long will that take? He said, the wait list now is 52 weeks. And I said, but wait a second, isn't there any way to speed it up? And his doctor said, yes, there is a way to speed it up. If you see a specialist, you can get it done a lot faster. And my friend asked, well, how do I see a specialist? I said, you can't see a specialist until you get your MRI first. I think of a friend up there who had cancer, had a brain tumor. He had to come down here to get it solved. It was a 4.5-month wait for his MRI, a 4.5-month wait for his surgery. There was a broker up in Calgary, actually in Vancouver, who helped arrange him to come down to the safe United States. It was taken care of in a week. It saved his life. When I talked to the broker, he looked at me and he said, please, whatever you do, don't do what we did in the United States. And I expected him to say, because if you do, you'll die too. He didn't. He said, because if you do, we will have no place to escape to. I've been debating with this, and pardon me if it comes out rather clumsy. It's been 7 years since I talked about my daughter's death. My daughter died of a vicious and extremely rare cancer. She was a year old. When she became sick, she got an MRI immediately. When she needed surgery, it happened the next day. They did all they could for her. I would not have known what killed her if we had the kind of system that we're talking about implementing. She would have died without the MRI. She would have died without the surgery. And today I'd still be wondering. It's been 5 years now since my son, who has Down syndrome, at a month old, had a life-saving immediate procedure to save his life, an open heart surgery to close an open hole. He couldn't breathe, he couldn't move. I don't know if he would be alive if what Obama is pushing was in effect then. This little man has gone through 8 surgeries now in his life. He's had the best care in the world. This is not about some damn principle. This is not about what's good fiscal policy or what's bad fiscal policy. Damn it, this is about my children. We have a system now that will not only take away our children's lives, perhaps my child's life. We have a system being proposed here that will make those children who survive pay for our care now. We, not them, we must take the leadership role. We must stop this. I know it's tough to take time away from our families. I know it's tough to take away time from our jobs. It's expensive to be here. We're not on the Takings Coalition. We're not getting money from this. We're not the folks who are looking for the handout. We're here because we care. This is what it's going to take. We're not going to let this happen.
Thank you, Jon, and thanks for sharing the story about your family and your experiences, and we all have those.